If your cat lives long enough, they will eventually get an older cat disease. If you had to choose which disease your cat got in their later years, which one would it be? For me, hands down thyroid disease. It's easy to diagnose. Cats often live years with treatment, long enough to pick up another older cat disease, and you have all the options for treatment. So let's chat about thyroid disease in cats. Hi everyone, I'm Dr. Oz. This is your one-stop shop for everything relating to thyroid disease in cats. In this video, I'm going to chat about what the thyroid hormone does, symptoms associated with thyroid disease, how we diagnose it, how we treat it, and you have a ton of options to choose from, and a few things you may not know about thyroid disease in cats. This video has something for everyone, including those of you who are currently treating a thyroid cat. And if you learned something new, let me know by leaving a comment. Quick species comparison. Looking at these three species, does the thyroid go up or down with each species? In the dog, it is typically low. Humans can go both directions, up or down. And in cats, it is generally high. The only time I see a low thyroid in a cat is after a too aggressive radioactive iodine treatment, which we'll touch on in a little bit, or a genetic disorder in kittens, which is super rare. Thyroid disease is one of the most common disorders I diagnose in an older cat. When the thyroid hormone goes up, that is known as hyperthyroidism. So how common is hyperthyroidism in senior cats? It is estimated that 10% of all senior cats will develop hyperthyroidism. In your cat's neck, on both sides of the trachea or windpipe, are two little thyroid glands, one on each side just below your cat's voice box. If you ever see your vet stroking your cat's neck, they are probably checking to see if they can feel your cat's thyroid glands. And if they do, your cat will probably be hyperthyroid at some point. Hyperthyroidism in a cat is characterized by a benign growth or tumor known as an adenoma in one or both of your cat's thyroid glands. The gland gets bigger and releases more thyroid hormone into the body. Very rarely, a large thyroid gland is due to a cancerous tumor known as an adenocarcinoma. And the reason this happens in some cats is because we don't really know. What percentage of hyperthyroid cats have a benign thyroid adenoma versus thyroid carcinoma? By and large, 98 to 99% of hyperthyroid cats have a benign growth in their thyroid gland or glands, accounting for an increase in thyroid hormone in the body. Cancer is very rare, accounting for less than 3% of all hyperthyroid cats. Now, we really don't know why some cats develop hyperthyroidism, and there are a few theories out there. Some point the finger at fish-flavored canned foods with a pop top or iodine levels in cat food. Others blame a flame retardant commonly used in furniture and carpet. The jury is still out on a true cause, and none of these theories has been proven definitively to cause hyperthyroidism in cats. What percentage of hyperthyroid cats have both glands affected? 70%, even though only one gland may be large. We'll get to why this is important in the treatment section of this video. To understand the symptoms of hyperthyroidism, you have to know a little bit about the thyroid hormone and what it does in the body, and there are many functions to this hormone. It is used to help control metabolism, specifically the breakdown of fats and carbohydrates, regulate body temperature, control heart rate, help maintain muscle tone, help the nervous system function, and help maintain a cat's skin and fur. Now that you know what the thyroid hormone does, can you guess the symptoms when there is too much thyroid hormone in the body? Back to the previous chart, too much thyroid hormone increases the metabolism, resulting in weight loss. Temperature regulation is off, and many of these cats are heat intolerant. That's why you'll find them lying on cooler surfaces, like a bathtub or tiled floor. Too much thyroid hormone causes the heart rate to go up, and when you listen to their chest, their heart is beating extra fast. Many cats are muscle wasted on top. You can easily see and feel their spine and pelvis. Since these cats are losing weight, their appetite can increase significantly. They often drink and urinate more. And because it affects the nervous system, oftentimes cat parents notice odd behaviors in their cat prior to a diagnosis, including hyperactivity, with many cat parents reporting their older cat is acting like a kitten and being very vocal, especially at night. And since it affects the skin and fur, many hyperthyroid cats will have a hair coat that looks less than fabulous, oftentimes unkempt, greasy, and matted. When a cat parent tells me that their senior cat has a great appetite, warning bells go off. If your senior cat is more active in eating a ton of food and losing weight and becoming bony, so much so that you can see and feel their spine, hyperthyroidism may be the cause. Other symptoms can occur but are much less common, like vomiting, diarrhea, fever, lethargy, and anemia. Since everything is ramped up in the body, some cats breathe fast. Some of these cats will become aggressive, and the extra work being done by the heart may result in your vet hearing a heart murmur. If I hear a heart murmur for the first time in an older cat, I start to think about hyperthyroidism. Think of it this way. When the thyroid hormone goes up, way up, it's like your cat is running a marathon internally. The extra hormone causes the heart to beat faster and pump harder to meet the increased metabolic demands of the body. And this can lead to a number of things. The heart muscles thicken and get bigger. We all know extra work at the gym leads to bigger muscles. But when the heart muscles get bigger, the blood does not flow through the heart normally as it should. Now, the body's heart is pumping blood inefficiently, which may result in a heart murmur. An arrhythmia or an abnormal heartbeat may result, not the typical lub-dub sound the heart makes while listening with a stethoscope. Beating faster and harder may result in higher blood pressure, which may affect sensitive organs like the retinas or the kidneys. A heart with thickened muscles, especially in the left ventricle, is called HCM, or hypertrophic cardiomyopathy. And all of these changes are in direct response to high thyroid hormone levels, which is called thyrotoxic cardiomyopathy. The good news? Most of these changes can be minimized or reversed if high thyroid levels are caught early enough and treated. Super fancy word to use at your next dinner party. Thyrotoxicosis. Any condition in which there is excessive amount of circulating thyroid hormone. You're welcome. We really only need one test to diagnose hyperthyroidism in cats, the T4 or thyroxine blood test. It's pretty straightforward, but it can be tricky at times. Now, each laboratory will have their own T4 reference range, so take this next section with a grain of salt. Generally speaking, an older cat should have a T4 less than 2.5. For me, a T4 above 4 is thyroid disease and I begin treatment, especially if a cat is showing symptoms. A T4 level of 4 can fall within the normal reference range for some labs, but I would argue it is probably high normal in most cases. And a high normal thyroid, again, for me, will eventually become a hyperthyroid cat at some point. It is perfectly fine to wait and see what the thyroid does down the road. Checking the thyroid in a few months will help determine if your cat is actually a thyroid cat or not. Wait a second, what if my cat's T4 level is between 2.5 and 4? What do you do then? Welcome to the gray zone. This is where we watch and wait. Throughout the day, the thyroid hormone normally goes up and down. The T4 result on your cat's blood panel represents the hormone level at that specific time. It says nothing about whether it has been higher or lower the rest of the day. Now, if it is high, it doesn't matter, we begin treatment. However, if it is in the gray zone, it might be higher or lower on a recheck visit. So, we wait a few months, recheck, and see where we are. For me, a cat that hangs around in the gray zone will eventually become a hyperthyroid cat. Now, there are some other blood tests that can help determine if your cat is truly a hyperthyroid cat or not, especially if their T4 is hanging out in the gray zone. Over the years, I've kind of backed away from these tests and really been focusing my attention on the T4 blood test. So, let's review the other tests that are out there. Free T4 blood test. No, this test is not free, it still costs money. Actual question I am asked on the regular. The free part of free T4 refers to the unbound version of the thyroid hormone in the blood. Normally, the T4 hormone is bound to a protein. Since T4 can be affected by other diseases in the body, a free T4 blood test may give a more accurate picture of what your cat's thyroid is doing. When another disease is suppressing a cat's T4 level, a condition known as sick euthyroid, the free T4 levels are less affected and can remain high in a hyperthyroid cat. In these cases, if the T4 is normal or in the gray zone, A high free T4 test can suggest hyperthyroidism. But you have to be careful. In about 15% of cats, the free T4 can be high for reasons other than thyroid disease. Free T4 should not be used alone to diagnose hyperthyroidism in cats. Due to the cost of this test and questionable application when diagnosing hyperthyroidism in a cat, I now forego this test and just recheck a T4 in a few months if I suspect hyperthyroidism in a cat with a quote-unquote normal thyroid level. What endocrine or hormone disease is more common than hyperthyroidism in cats? Nothing. Hyperthyroidism is the most common endocrine disease in cats. T3 suppression test. When you have a high suspicion of hyperthyroidism in a cat, but all the thyroid tests are normal, you can run a T3 suppression test. This test looks to see if we can lower or suppress a cat's thyroid hormone by giving a cat the T3 hormone, which is the active form of the thyroid hormone in the body. A baseline T3 blood test is taken, T3 hormone is given by mouth every 8 hours for 2 days, and a final T3 blood test is taken a few hours after the last dose is given. What should happen? The first thing you need to do is determine that the T3 level in the post sample is higher than the pre-sample. We were giving T3 for 2 days, so naturally T3 levels should go up. This also helps make sure the T3 hormone medication was given correctly. Next, we compare the T4 level and sometimes the free T4 levels from the pre and post samples. In a normal cat, if the body has too much thyroid hormone, the body should stop producing thyroid hormone from the thyroid gland, otherwise known as a negative feedback loop, and hormone levels should go down. So the post-sample levels should be lower than the pre-level samples in a normal cat. But in a hyperthyroid cat, the levels will be the same or hardly change at all. Again, I really don't use this test and just recheck a T4 in a few months. It is a rare day when I cannot diagnose hyperthyroidism in a cat with a T4 blood test. It may take a few months, but I eventually find them. Now, if I have a cat that is losing weight, I suspect hyperthyroidism, but that T4 level is in the gray zone, I am looking for another cause and will revisit a diagnosis of hyperthyroidism later. Too often, cats are diagnosed and treated with hyperthyroidism that continue to lose weight. Spoiler alert, it's not the thyroid disease that is causing the weight loss. More on that in a little bit. What vitamin am I thinking about when I diagnose hyperthyroidism in a cat? B12. When I diagnose hyperthyroidism in a cat, I always run a B12 blood test, which I'll get to a little later in this video. Your cat was just diagnosed with hyperthyroidism. How do you treat it? Fortunately, you have all of the options. When it comes to treating hyperthyroidism in cats, options include diet, medications, surgery, and radioactive iodine. And each one of these has advantages and disadvantages. So let's look at each treatment option in more detail. This diet has very little iodine, which can help reduce your cat's high thyroid hormone levels back down to normal. The thyroid gland needs iodine to make thyroid hormone, so if you limit the amount of iodine in the diet, essentially the thyroid gland cannot make thyroid hormone, and the thyroid levels should return back to normal. The iodine levels are low enough to prevent excessive thyroid hormone, but not so low that it causes iodine deficiency. With this balance, Hill's YD can help manage hyperthyroidism. It is not a cure. It comes as both a canned and dry food. It has to be fed 100% for the rest of your cat's life. You cannot feed treats or other flavored medications, all of which may contain iodine. This can be challenging in multi-cat homes where we really do not want other cats eating this diet, even though it has been shown to be safe in healthy cats eating this diet for over a year. And of course, the biggest obstacle to this option is a finicky, picky cat, which seems to become more common with age. My personal experience with clients that have chosen this option: initially the diet works great in most cats, but not all cats, And in some cats, after years of eating the diet, the thyroid can drift upward and we end up having to reach for a different treatment option. So, if your cat eats a diet, this is a great place to start. Just keep monitoring their T4 levels to make sure the diet continues to work. One important point is that while this diet can lower your cat's thyroid hormones in the body, it does nothing for the abnormal thyroid glands in your cat's neck, which can get bigger with time. Pretty much every hyperthyroid cat will end up on this medication at some point, and you have so many options. Tablets, liquid, getting it compounded into a flavored liquid or flavored treat. You can even get it compounded into a transdermal cream. That is applied to the skin on the inside of the ear, and the medication gets absorbed through the skin. One of the few medications that actually works this way. This medication works by interrupting the thyroid hormone production process within the thyroid gland, effectively lowering thyroid hormone blood levels. This is a lifelong treatment to manage hyperthyroidism. It is not a cure. And just like with the YD diet, it does nothing to address the abnormal cells in the thyroid gland. With time, the thyroid glands will continue to get bigger, produce more thyroid hormone, and the medication dose will need to be adjusted up accordingly. What are the only two thyroid medications approved for use in cats by the FDA? Filimazole and Filanorm. Filimazole is a methimazole tablet that comes in two sizes, 2.5 milligrams and 5 milligrams. Filanorm is a methimazole liquid suspension. Generic or human-approved methimazole, despite being used all the time to treat hyperthyroidism in cats, has not been proven to be safe and effective in cats, and its use is considered extra label. I cannot stress this enough, hyperthyroid cats need to be treated twice a day, roughly every 12 hours. Once-a-day treatments just won't cut it and are not recommended. Don't take my word for it, you can read the article for yourself. Link is in the description. Side effects, which generally occur within the first 3 months of starting methimazole, may occur in 10 to 20% of cats taking methimazole, like vomiting and loss of appetite. Rare, severe side effects may occur in about 2 to 5% of cats, including low neutrophil counts, a type of white blood cell, low platelet counts, liver issues, and facial excoriations, characterized by intense itching and scratching. In these rare extreme cases, stopping the medication typically resolves the issue and another treatment avenue needs to be pursued. Transdermal methimazole can be used to treat hyperthyroidism in cats, and the main benefit is increased owner compliance. It is recommended to wear gloves when applying it to your cat because you can absorb it. Alternate ears between applications, for example, the right ear in the morning and the left ear in the evening, and remove any crust that may have formed inside the ear before applying a new dose. Transdermal methimazole may help cats with digestive symptoms while taking methimazole by mouth. If your cat is vomiting on oral methimazole, it may be worthwhile to try transdermal methimazole to see if the vomiting goes away. Transdermal methimazole does not prevent the other rare side effects. It does take longer to control a cat on transdermal methimazole over the oral route, but eventually they get there and are just as controlled. As you now know, 70% of hyperthyroid cats have both glands affected, even though only one gland might be large. So, if you do this surgery and only take out the big abnormal thyroid gland, there's a good chance the other gland will become big and you'll have a hyperthyroid cat again down the road. If you miss one abnormal cell during the surgery, the thyroid growth can come back. Let's say you do the surgery perfectly. There's a small chance there may be thyroid tissue somewhere else in the body making more thyroid hormone. In these cases, surgery cannot fix the problem. But the big reason why I do not recommend this surgery is a potential serious complication, damaging or removing the parathyroid glands, small glands near the thyroid glands. Low calcium is the biggest concern if you mess with the parathyroid glands. This is typically not permanent, even though it may take months to self-correct. Another lesser known risk is the effects of a low thyroid level on the kidneys. After this surgery, low thyroid hormones are expected and generally not supplemented unless a cat is showing symptoms related to low thyroid levels. With time, these levels generally come back to normal. However, during this time when the thyroid levels are low, it may increase the risk for chronic kidney disease progression. Cats' kidneys are so sensitive. And I haven't even mentioned the inherent risk of anesthesia and surgery being performed in an older cat, possibly with high blood pressure, underlying heart disease, and/or kidney disease. This is the gold standard treatment for hyperthyroidism in cats. The big advantage with this treatment is that it is permanent. And not having to treat your cat with a medication? Priceless. What percentage of cats have thyroid tissue hiding somewhere else in the body? It is estimated that up to 20% of thyroid cats have thyroid tissue elsewhere in the body, not just in the thyroid glands. This treatment destroys abnormal thyroid tissue wherever it is in the body. It also preserves those tiny little parathyroid glands nearby. Rarely, a cat may need a second dose. If the treatment is too aggressive, your cat may become hypothyroid or develop low thyroid levels, which, you guessed it, needs to be supplemented with an oral medication. The big drawbacks from this treatment are: it is expensive, only certain hospitals are licensed to administer the injection, and your cat needs to be isolated for days to weeks depending on your state laws. If you have a newly diagnosed hyperthyroid cat, which of these 4 options mentioned in this video seems like the best fit? Let me know and ask any questions you may have down below. If you have a thyroid cat on one of these treatments, share your experience in the comment section. All right, let's see how much you are paying attention. Of the 4 treatment options mentioned in this video, which options may provide a cure for hyperthyroidism? If surgery is done correctly, that could be a potential cure, and radioactive iodine treatment has a 95% success rate. This should come as no surprise, but once we diagnose hyperthyroidism in a cat and begin treatment, or we make an adjustment to a current dose, we need to monitor the body's response to that change. I want to check the thyroid level in 3 to 4 weeks after starting a treatment or making a dose change. Otherwise, in a healthy hyperthyroid cat without any symptoms, I'm typically checking the thyroid levels in 3 to 6 months. And I'm not just checking a T4 level, I'm also checking a complete blood count, looking for changes in the white blood cells and platelets, especially during the first few months of starting treatment. I'm also looking at other things that the medication can affect, like the liver and kidneys. Many cats with uncontrolled thyroid disease will have an elevation in the liver enzyme ALT, which typically resolves once the thyroid is back to normal. Thyroid disease is also known to hide kidney disease, since the metabolism and blood pressure can be high in an uncontrolled thyroid cat. More on that later in the video. My goal is to get the T4 level down to around 2.5. If I have a T4 level in the gray zone, I don't necessarily make a change in an otherwise healthy cat. However, I'm watching that cat a little closer with the anticipation that the thyroid will continue to go up and I will need to adjust the dose accordingly. What if the T4 level is too low? The knee-jerk reaction is to back off on the medication dose, and this is a no-brainer in a newly diagnosed hyperthyroid cat because the starting medication dose is too high. But in a cat that has been on a consistent methimazole dose for a while and has a low T4 level, I'm looking for a different cause, as sick euthyroid syndrome may be at play here. That's when a different disease process is artificially lowering the T4 levels. I really haven't seen a low T4 level on a cat on the YD diet, and if your cat has a low T4 level after a radioactive iodine treatment, well, that's a conversation to have with them. In theory, you can get away with checking just a T4 level in a hyperthyroid cat. In reality, since the thyroid hormone affects everything in the body, you are much better off running full labs every 3 to 6 months. That's a complete blood count, chemistry panel, and T4. And for me, I like to run a senior screen in any older cat at least once a year. That's a complete blood count, full chemistry panel, T4 level, and urinalysis. What disease are hyperthyroid cats more prone to get? Urinary tract infections. So, occasionally I'll run a urinalysis, typically part of the annual senior screen, to make sure nothing is popping up in the urine. Now, if a hyperthyroid cat is showing urinary symptoms, I'm adding a urine culture and sensitivity in addition to the urinalysis with the anticipation that the cat has a urinary tract infection. For more information about urinary tract infections, which are rare, check out my Urinary Tract Infections in Cats video. Going in the opposite direction for a moment, one situation where thyroid levels may be low is with congenital hypothyroidism. Rarely, the thyroid gland may not develop correctly in a kitten, resulting in an unusual appearance that includes a small, stocky frame, wide head, and short limbs. These kittens typically do not grow like a normal kitten, are lethargic, really don't do too well, are mentally dull, have an abnormal coat, have thickened gingiva, and retain their baby teeth. I typically get a sense that this may be the case in a kitten that presents with constipation. T4 levels are obviously low in these kittens and if caught early, can be managed by administering thyroid hormone supplements. One condition known as sick euthyroid syndrome can make diagnosing hyperthyroidism in a cat challenging. Here, another disease process lowers the T4 level back into the reference range, making it appear a cat is not hyperthyroid. Sometimes, it is only after diagnosing and treating another disease that you learn the true T4 levels in a cat. I've diagnosed a few hyperthyroid cats in this way. It was only after treating another disease that I learned what I thought were normal T4 levels was actually not the case. As the thyroid hormone levels increase in the body, the metabolism and blood pressure increases as well, and this can mask underlying kidney disease. It is only until you get the T4 levels back to normal that you may realize that the kidneys aren't working as well as you thought. This is one example that highlights the importance of running full labs at a recheck appointment. A complete blood count and a chemistry panel in addition to a T4 blood level not only allows you to monitor the thyroid, but also tells you what the kidneys are doing. And we all know, kidney disease is common in our older cats. If you want to pursue radioactive iodine treatment, you will need to run full labs before doing so. And as you can imagine, a cat with more than one disease is more difficult to manage. One common misconception is hyperthyroid treatments cause kidney disease. This simply is not the case. The kidney disease was there before the hyperthyroid treatments were started. And just so you know, not treating thyroid disease in your cat can actually cause more damage to the kidneys. One study showed 40% of hyperthyroid cats had low levels of B12, although other studies did not show this correlation. We know a number of cats with disease in the digestive tract will also have low B12. When the digestive tract is not working correctly, as is the case with inflammatory bowel disease or IBS, it doesn't absorb nutrients as well. The ileum, or the very end of the small intestine, is the location that is primarily responsible for absorbing B12 from the diet. A lot of digestive tract diseases in cats affects the ileum, so a low B12 can suggest something is wrong with the ileum, and that something is likely to be inflammatory bowel disease. So for me, in clinical practice, if I have a well-controlled hyperthyroid cat that is losing weight and all the labs are normal, I run a B12 blood test. If it is less than 500, I suspect something is wrong with the digestive tract in addition to thyroid disease. A conservative approach would be to supplement B12, add in a probiotic, and start a prescription GI diet. A more aggressive approach may be an ultrasound of the digestive tract, plus or minus GI biopsies depending on the ultrasound results. And this approach has worked very well for me over the years, so it's something to consider in all hyperthyroid cats. That's a lot of information. The good news is the prognosis for pretty much all hyperthyroid cats is good. and most hyperthyroid cats live long, happy, normal lives with the correct treatment. That's it from Meow. If you enjoyed this video, like, subscribe, and comment. Thank you so much for watching, and I will see you on my next video.